Hi everyone, my name is Lindsay Garcia and this is my senior capstone project for NUR 430. In this presentation, I am going to go through four major sections: my community health assessment, what I learned about health equity and the four spheres of care, my community learning experience at Exceptional Care for Children, and then a reflection on my overall RN/BSN journey. So I'll start with section one, which is community and population health concepts. For my community health assessment, I focused on Middletown, Delaware. Going into this, I thought that I already understood the community pretty well, but doing a windshield survey and reviewing data really changed how I look at it. Middletown is definitely a rapid growing suburban town, which has a lot of strengths, things like clean neighborhoods, strong schools with the Appoquinimink School District, many parks and walking trails, and the Christiana Care Emergency Department, which offers 24/7 care. There are also plenty of outpatient clinics and urgent care centers, which makes basic healthcare fairly accessible. As I was able to dig deeper, I also noticed some significant needs in the area. One of the biggest issues that I saw was lack of reliable public transportation. I noticed that without a car, it is extremely difficult for residents to get to an appointment or even access basic services. Mental health is also another major gap. Access to any of those services, providers tend to have long wait lists, and then people often will have to travel out of town for counseling or psychiatric services. Another concern I identified was around maternal and infant health. Delaware's rates for infant mortality, low birth weight, and premature birth are higher than national averages, and Middletown reflects those same challenges. Along with that, rising household costs and affordability issues are becoming more noticeable as the population in Middletown grows too. When I created my community report card, the picture became even clearer about the community. Economically, Middletown looks strong, but affordability is becoming a real barrier. A lot of people are starting to come from out of state, uh, and they're able to afford the housing because it's cheaper than other states, but otherwise, the actual community of Middletown is becoming extremely expensive for those who have lived here. Health indicators show good access to basic medical care, but big gaps in behavioral health and maternal outcomes. Safety is generally good, but traffic accidents are increasing with all of the new development. And then education remains one of the strongest areas, although new schools are constantly being built just to keep up with the population. The social determinants of health that stood out the most were the economic stability, the built environment, healthcare access, and education. All of these played major roles in shaping the health of this community. This assessment really did change how I see population health. Instead of just viewing Middletown as a nice growing suburb, I now see some of the underlying barriers that impact families here every day. Um, and it's just things that you wouldn't notice unless you intentionally looked for them. So it just taught me how environment, policy, and community resources directly affect health outcomes. Now for section two, health equity, equality, and the four spheres of care. So throughout this course, I completed several assignments that really opened my eyes to how deeply health equity affects people's lives. A lot of barriers came up repeatedly, like transportation, accessibility for people with disabilities, lack of mental health providers, and gaps in community resources. When I looked at equity through the four spheres of care, everything connected even more clearly. So starting with sphere one, disease prevention and health promotion. Um, Prevention only works when people have access. So if someone doesn't have reliable transportation, or if health information isn't explained in a way that they can understand, they're already at a disadvantage. In my community assessment, the lack of transportation was one of the biggest barriers. And then at Exceptional Care for Children, prevention is built into everything. Strict infection control, ongoing education and screening. But even then, equity still plays a role based on each family's resources and support system. For Sphere 2, chronic disease care, managing chronic conditions requires consistent follow-up, which becomes really difficult with the provider shortages or insurance restrictions. In Delaware, mental health is a huge example of this. Like, wait lists can be months long. As a case manager, I also see how Medicare Advantage plans sometimes limit patients with which specialists they can see, amongst just being approved for other resources as well. And then just pulling it into my clinical site, families at Exceptional Care for Children deal with these challenges constantly. So it just pulled everything together to see how difficult it is, and how much it affects chronic conditions. Sphere 3, regenerative or restorative care. This includes trauma care, ICU level care, acute exacerbations of chronic conditions. Issues with Middletown, there's no inpatient hospital, which means residents either have to travel to Newark, Wilmington, or Dover for higher level services. That can create delays and inequities, especially for people that, again, don't have reliable transportation. Outcomes in emergencies can definitely differ based on socioeconomic factors. And then Sphere 4, hospice, palliative, and supportive care. End-of-life care is affected by things like insurance coverage, caregiver resources, cultural beliefs, and sometimes financial limitations. Not all families have equal access to hospice or respite care. Again, tying in Exceptional Care for Children, I see how much support families need and how much the system doesn't always provide, especially when they want to take some of these kids home. My biggest takeaway from this section is that equity isn't about giving everyone the same thing. It's about giving people what they actually need to reach the same level of health. I feel like this course really made me much more aware of how systems and social determinants shape outcomes long before someone reaches a healthcare facility. Moving into section 3, which again is my community learning experience at ECC, which was absolutely amazing. I was able to go to Exceptional Care for Children, which is a pediatric, long-term, and transitional care facility. It cares for medically fragile children with a wide variety of complex medical needs. It really helped me to see community health nursing in a different light. The nurses at ECC were absolutely incredible. They apply health promotion and prevention in so many ways, through strict infection control, medication management, developmental support, and then, of course, continuous education and communication with the families and caregivers. Care coordination is really huge there. There's constant communication with specialists, therapists, schools, outside agencies. They round on the kids every week. It was just really cool to kind of see all of those pieces come together. Some of the barriers that I identified included transportation challenges for families. There's not a lot of facilities around like ECC, so unfortunately in Delaware, they are the only facility for kids with chronic conditions like that. So they have, I believe, 54 beds. And unfortunately, there are multiple kids who are waiting to be placed at facilities like this. So you can imagine that families are coming from far away just to have their child in a facility like this. So if they have any transportation challenges, it can be a real barrier. And then there are insurance limitations, delays in specialty care, caregiver burnout, and just difficulty navigating the complex system of everything. These issues definitely impact the family's ability to keep up with their child's ongoing medical needs, and I can't imagine being in that position. The strengths at ECC were very clear. The staff is so dedicated. They love those kids like they are their own. The teamwork is strong and the environment feels safe and nurturing. It doesn't feel like a nursing home. It feels like just a home for these kids. You can tell that they're really loved and well taken care of. You can tell that they just have their best interest at heart. The infection prevention there is great, and every child has their own individualized plan of care. The weaknesses were mainly just system level issues, which ECC can't really control. I also saw a lot of examples of equity, justice, and inclusion. The staff, they advocate for those kids, again, like they are their very own. They advocate for the families who might not have the medical knowledge or resources or energy to navigate the system alone. They take these care plans and make them take into account the cultural background and family preferences and all the developmental needs of the kids. And they try to include families as much as possible in planning and decision making, in every step of the way for the kids, which I just thought was so awesome. My nurse mentor, her name was Rachel. She was involved in a quality improvement project that focused on improving hand hygiene compliance through staff audits. So this made a big impact because the kids at UCC, they are extremely vulnerable to infections. The project increased staff awareness and consistency overall and just made it a safer environment to be in. And then for my teaching project, I created a toy cleaning protocol for all 3 playrooms. So exceptional care for children is 3 floors, and each floor has a playroom. So I provided a demonstration, created a laminated checklist, and taught night shift how to sanitize toys properly. The sessions went really well. Staff were really engaged, and they completed the return demonstration correctly. They also all expressed understanding and how important it is in preventing infections. Like I said, they really care about these kids. They want to keep them safe. This experience overall really shaped my understanding of what a culture of health looks like. It's not just about medical care, it's about equity, advocacy, communication, and just creating an environment where families feel supported and included. It showed me how much of a difference that nurses can make beyond direct patient care. Then moving on to section 4, which is my RN BSN program reflection. So it has been an incredibly long journey for me. And as I reflect, I can see how much that I've grown both personally and professionally. So I actually graduated from BB and I was a diploma nurse. At that point in time, I focused mostly on bedside care and what was happening in front of me at the moment. Being a new nurse is scary. I got a job right in the ICU. It definitely pushed me to limits that I didn't even know existed. Then once I started the BSN program, it really pushed me to think more broadly about things like policy and leadership and community health and the system that really affects patient outcomes. My understanding of nursing roles expanded. I now see myself not just as a clinician, but also as an educator and a leader, a researcher, and an advocate. Like this, it just helped broaden my idea of what nursing is in general. Through this program and my work experience, I feel like I've gained more confidence in teaching others, in speaking up for my patients, and in using evidence-based practice in decision making. 2 experiences that really represented integrative learning for me were the toy cleaning project at UCC and then my 4 pillars of population health assignment. The teaching project really combined infection control, communication, quality improvement, and education into one meaningful intervention. And then the 4 pillars assignment helped me to connect mental health access issues, policy barriers, and public health trends in Delaware. The courses that influenced me the most, honestly, probably this one. I work in case management, so I really felt close with public health, and I feel like it made me open my eyes to more than I would if I just worked bedside. I see a lot with the community health, and I think that this course helped me to understand the social determinants of health and try to create meaningful interventions every time that I was at work. Nursing leadership was another great course that also helped me to strengthen my communication, my confidence, and ability to advocate effectively for both myself and my patients. In the future, I'm interested possibly in becoming a nurse educator, or pursuing something in the psychiatric mental health nursing. I'm really interested in being a psych NP and hopefully moving on to help with psychiatric issues in women's health. I struggled myself after having a baby with postpartum depression and something called PMDD, and I feel like I can really relate to women who are going through these things. So although I'm going to take some time off, I definitely want to expand and keep going, and hopefully get my psych NP in the future. I enjoy teaching, and I'm just passionate about advocacy and supporting vulnerable populations. If I could recommend improvements for the BSN education, the only thing I can think of is maybe more hands-on content related to like mental health access, case management, and insurance navigation. I just feel like these are things that aren't necessarily taught a lot, if that makes sense. These are real issues that nurses face every day, but unless you're engulfed in it, like unless you work in case management or mental health, you don't really have that much experience with it. For the art form that represents my vision of nursing, I chose a bridge. A bridge symbolizes, I feel like, what nurses do. We connect people with resources, support, and any answers that they need. We help them to cross difficult circumstances safely. We close gaps, and that's exactly how I see community and public health nursing. Lastly, I plan to continue lifelong learning through hopefully some certifications, like I said, future graduate education, and just staying up to date on evidence-based practice. I feel like nursing is always changing, and I want to keep growing in the profession. And that is it. Thank you guys for taking the time to watch my senior capstone. I am grateful for the program and the growth that it has brought me in my practice, and I look forward to continuing my journey.